Hello guys, this is Dr. Palane Parmanikam. I'm doing this quick video in my hospital because I wanted to clear some of the controversy surrounding my videos as well. Since I've been like pro-vaccine throughout the inception of COVID, through the inception of this YouTube channel, people are thinking that I'm discriminating unvaccinated people, similar to how people who are eating chicken biryani or discriminating people who are eating vegetable biryani. I'm here to say that is not the case, and let's dive deep into it and just focus on these unvaccinated patients alone. So I thought about how to explain this in detail and very concisely and clearly. So the only way that I could think of is to classify into 4 different groups to understand the risk and benefits of vaccines. Let's see what are the groups are. So group 1 will be the unvaccinated group. In addition to the unvaccination, they also have this underlying medical problems, which will include heart problems like heart disease, lung problems like asthma, COPD, liver problem like fatty liver, or kidney problem like dialysis or chronic kidney disease, or uncontrolled diabetes mellitus, and more importantly, especially for Indian patients, the abdominal obesity. If your waist circumference is more than 100 centimeters, you belong to this category of underlying medical problems. And group 2 will be the unvaccinated group, but still they are healthy. They don't have any underlying medical problems. And group 3 would be vaccinated, but they have underlying medical problems. And number 4, group 4 would be vaccinated and healthy. So to briefly summarize these groups, the first 2 groups are unvaccinated, the third and fourth groups are vaccinated, and I can clearly tell you that vaccination decreases the risk of death and hospitalization on any given day, and I will tell you some data. The data I'm going to give you is right from my hospital, a live example, and that is what is happening throughout United States and throughout the world as well. So my ICU beds are completely full, and out of these beds, if you classify those patients into these 4 groups, 50% are group 1, unvaccinated and underlying medical problems. 40% are group 2, unvaccinated but healthy. 10% are group 3, vaccinated but have underlying medical problems. But the group 4, vaccinated and healthy, not even a single patient is in ICU. My friend Saravana Kumar is like, "Hey, nee summa solra, vaccinated people will also come to ICU." Yes, they will come to ICU, but just to visit the unvaccinated people. They literally come to ICU and they say, "ICU, bye-bye." So, okay, then let's focus on the step down unit. So, one unit below the ICU where they don't need intensive care. So, if you take those group of patients, especially in my hospital, and that is the data throughout the world as well, if you see that 40% belong to group 1, unvaccinated, underlying health problems. 30% belong to group 2, unvaccinated but healthy. 20% belong to vaccinated and underlying medical problems, and 10% belongs to vaccinated and healthy. So again, it's emphasizing the point that vaccination will not prevent you from getting an infection, but if you get an infection, you will not require a longer hospitalization or an ICU admission as well. So if you look at my hospital census, it looks like a table mat ad. All unvaccinated patients are like, unvaccinated people 8th bed இருக்காங்க, பக்கத்து பெட்ல இருக்காங்க, சில பேர் மேலேயும் போயிட்டாங்க. So does this mean that I hate unvaccinated people? Absolutely not. I never hate anybody. I just hate that person who wrote about Simbu that he will not have a comeback. Look at Manad. Except that I love everybody. Then I will treat everybody as well. But I pity these groups 1 and groups 2 for the following reasons. So number 1, if you're in group 1 where you're unvaccinated and also have underlying medical problems, I showed you the data that I'm currently seeing live in my hospital that there is an increased risk of hospitalization and ICU requirement and sometimes death as well. So for group 1, I pray to all gods, Jesus, Allah, Muruga, for all gods, and making sure that these patients don't get exposed to Omicron so that we can save their lives. So it's almost like coronavirus is playing lottery with our body. It comes inside the body and scratches the body. If it says unvaccinated, it gets happy, and it says immunocompromised, it gets double happy. அடிச்சாண்டா அப்பாயின்மெண்ட் ஆர்டர் சின்ராஸ் இனிமே பிடிக்க முடியாது அப்படின்னு சொல்லிட்டு Omicron is running around. But when the virus scratches the body and it says it is vaccinated, it is almost similar to Google Pay. It says better luck next time. So how about group 2 where they are unvaccinated but they don't have any medical problem, they are healthy? Again, there is a problem because there is this concept that Omicron infection is very mild, so it will not cause any significant problems, but that is not true for unvaccinated people. We do see healthy see young unvaccinated people in ICU requiring intubation, requiring ECMO for heart and lung failure. That can happen. Yes, it doesn't happen as much as people with underlying medical problems, but it is not zero. So for group 2 as well, I'll pray to the same gods that please don't expose these patients to Omicron. Group 1 has failed miserably in the exams, and group 2 is trying to pass with grace marks with God's grace. So now I'll come to the most important discussion. Many patients are telling me that, hey, you know what, I'm healthy. I know that Omicron is going to be mild. I don't want to get any vaccine at all. I will be in that group 2. I'm okay to take that mild risk. But the risk is not only for you, the risk is for others as well. That is where the transmission risk comes under. So people are arguing that both vaccinated and unvaccinated people transmit the virus at the same level, which is absolutely not true. Multiple studies have shown that the peak viral load, the amount of virus in the body, is equal for both vaccinated and unvaccinated, especially with Omicron getting concentrated in the upper airways. That is true. But what is not true is the level of transmission, the duration of transmission. The shedding of the virus of a vaccinated patient is much less compared to the unvaccinated patient. I will show you this diagram using a research article. So this is the graph I'm talking about. In the left hand side, in the green, that's the unvaccinated group. The right one is the vaccinated group. The horizontal axis is the number of days that the virus is contagious. And CT count stands for cycle threshold counts, how much virus is actually there. So if you see, the viral count starts early, 2 days before the 0 days in both unvaccinated and vaccinated. And it peaks almost at the same time in both unvaccinated and vaccinated. But the key thing is when it dies down, look at this. In unvaccinated, it is 7.5 days, but in vaccinated, it is 5.5 days. So there is a difference of 2 days, which is 48 hours of transmission. And look at the G. Here, we are classifying unvaccinated and vaccinated. And on the left-hand side, the number of days. This is the clearance time according to vaccination status. So if you're unvaccinated, you're clearing the virus almost at 14 days. And if you're vaccinated, you're clearing around 8 days. So 50% less. So what does this mean in general is that unvaccinated patients transmit the virus slightly higher, in fact significantly higher compared to vaccinated group of patients, which is not a significant problem if you are healthy, but if you are immunocompromised, if you are diabetes. But the main problem for Indian patients is the waist circumference, thoppai circumference more than 100 centimeters. It is a big problem that is not recognized properly. So after reviewing all this, now you tell me vaccine. So with all this data, obviously we are disappointed towards unvaccinated patients because one life-saving measure, they are not able to adopt it, and unfortunately they are dying right in front of us. Any loss will affect us personally and also mentally as well. Doctors' mental health is absolutely important, especially in this pandemic. So that is why we are expressing that disappointment towards unvaccinated patients. When we lose a patient to a preventable disease, it breaks our heart, and there is only so much heartbreak that we can take. But if you decide not to get vaccinated, I'm okay with that as well. We will treat you when you come to the hospital. All I'm saying is when you are climbing up the stairs and decide to jump and you're going to fall on our back, I'm saying you don't jump. But if you decide to jump, we'll be there for you. தலைகீழா தான் குதிக்க போகிறேன் அப்படின்னு சொன்னா ஒன்றும் பண்ண முடியாது.